doctorarjaybe, and I wanted to talk a little bit about knee surgery and knee replacement. As people get older, it's fairly common to develop arthritis problems just from wear and tear of the bones. In normal situations, the knee surface should last for a lifetime, but there's always some slight injury that occurs as people do activities, and this injury can get worse over time and develop into arthritis. If, let's just say, somebody is playing football and they have a knee injury from football, even though they may recover from that injury will cause some damage to the surface of the joint. And so as people get older, this damage over time will develop into a situation where the cartilage will be worn down abnormally, and that's the cause of arthritis. In many cases, the knee joint that should be healthy is going to get worn down and damaged over time. The big thing with the knee is that because it's only held together by ligaments, if those ligaments get injured or get loose, the knee is going to have more play, and this causes more damage to the joint because of rubbing, and abnormal movements. Also, inside the knee, there's a disc of tissue called the meniscus, which is there to help with shock absorption and also with absorbing certain forces in the knee. If that becomes damaged and is no longer able to function, that also can cause abnormal rubbing of the knee joint and causing some damage to the surface of the knee. Now, the cartilage in the knee is slippery, kind of like the surface of your nonstick frying pan, the old Teflon or whatever. And because of this slippery surface, the bones don't really rub together and cause a lot of damage. Once that cartilage surface has been injured or damaged, then the joint can rub abnormally and eventually can rub to the point where there's just nothing left but just two bones rubbing together. This causes a lot of discomfort and pain. So when it gets to the point where we're talking about the knee joint being bone on bone, then there's some consideration about doing surgery. Now, I think the important point, even at this point, is whether or not there's disability involved too. If you got a knee joint that looks, horrible on x-rays, but you're doing everything that you need to do. You can go up and down stairs just fine. You can do things like play tennis, ride a bike, go jogging. There's really not a good reason why you have to suddenly go have your knee replaced. On the other hand, if you're getting to the point where you're having difficulty walking, you're having difficulty getting out of a chair because of the difficulty with using your knees, difficulty going up and down the stairs, at this point, you might want to consider having knee surgery done because it's more of a disability event. If you have to have assistance to get out of a chair because you're having difficulty with stiffness of your knees, if you can't go up and down the stairs because your knees are so stiff that you're having trouble being able to lift your leg up enough to get to the next stair, if walking becomes a difficulty where you can't get around, you're having to use a walker or a wheelchair, at this point you got to ask yourself, what good are these knees? Since surgery can have certain complications, it's always good to kind of think about whether something is really important or not. Now, I can tell you from my own standpoint, I have two bad knees that have arthritis in them, but I can go up and down the stairs fine. I actually go out for walks and jogs outside. I can do anything that I really want to do, and I'm very active. So for me, it's not that important, I think, to get knee replacement done. But if I got to the point where I couldn't walk, if it got to the point where I couldn't get up the stairs anymore, then I would probably consider having the surgery done. So I think that's the important thing, not to have surgery unless it becomes a disability issue. Just having arthritis, pain in your knees, you can always take some Tylenol, you can always take some arthritis medication. That's not the real reason to have the knee replacement done. But when, like I said, your knees are getting so stiff, you're having trouble getting out of the chair, having trouble getting up the stairs, at that point, it's probably a good idea to consider it. They do have some better prostheses these days that they use for knee replacements. In the old days, the old knee replacement was a joint surface that was attached to a long rod. This was driven into the bone and caused some, injury to the bone in some cases. Also, they had to remove a large portion of the bone, of the thigh bone and the shin bone, to get these prostheses in place. The new prosthesis removes a lot less bone, and the stem of the prosthesis is very short. So it doesn't cause as much injury to the bone. And because they remove less bone, it's a lot easier to get everything put together. There's a lot less damage to the bone, so less discomfort after surgery. Also, these days, people are functional a lot quicker. So instead of maybe 6 months of rehab, maybe within a few weeks you're able to walk again, and maybe not do everything perfectly, but with the help of physical therapy, can get back on your feet and doing things fairly quickly. So there is some improvement in surgical techniques these days, and like I mentioned, if you're the right candidate for the job, if your x-rays show that this is going to be helpful, then I think it's a great procedure. You just have to keep in mind that we're really not talking about sore knees, we're talking about disability. Okay, take care.